The East Coast Tour continues on True Patriot Love. And today we're in St. John's and we're lucky enough to have Dr. Liam Kelly. Welcome. And you are the Director of Research and Innovation for Health Services, Newfoundland and Labrador.
Yes,
Did I get that right?
Yes,
yeah,
that's
good,
right.
good.
Yeah, I just Liam for
okay.
now. Yes,
Thank you.
Great.
Thank you. Appreciate it. I'll call you Doc if that's okay.
It's up to you. Yeah.
So I was traveling in yesterday and I was reading up on your bio.
Yes.
Very impressive. And you're homegrown.
I am, yeah.
Yeah. You grew
Born
up
and raised St. John's, yeah.
In Gander?
In Gander, no.
No,
It's in Mount Pearl.
Mount Pearl.
Yeah.
Sorry. Yeah. Okay.
Yeah.
So, and you grew up here, and your specialty. So and you can tell me about it because you lived it. But you started off kind of with a really keen interest in kinesiology and physiology.
That's right.
Because of your wrestling background and so is that what got you into? I'm always amazed. Because, the dedication it takes to get into the medical health business is so interesting to me because it has to be a passion and a commitment and something that catches you, that brings you in because, how much time do you spend in schooling?
Oh, yeah. Well, a long time, right? So all of it. So kinesiology was an easy choice for me because sport was so important to me. And always sport performance and how do you get better playing baseball. As you said, with wrestling and stuff like that. So, so that was my undergraduate degree, was focused on, human performance, sport performance, studied kinesiology, and then went on, did a Master of Science in exercise and environmental physiology, again, with that kind of sport mindset. But quickly, living in a small province in the eastern part of the country, sport is important, but the bigger challenges are related to health and well-being. So I wanted then to take what I've learned and what I've developed from sport performance to try to apply it to clinical populations. And that's why I chose to go into medicine.
Yeah. Well, you and I, so you finished. I started, so I played football.
Yeah.
And I decided at one point I wanted to go into sports medicine.
Okay.
So that was my
Very
big
cool.
thing. I was going to sort of go down that path. And I got going, and I started off at U of T. That's where I was going to school. And I went and did a work term at Old Northwestern Hospital in Toronto. Okay. And I thought, definitely I was going to start working with athletes and I was going to be doing all this stuff. I went in and they actually put me in with stroke victims.
Okay.
So I had to do rehab with stroke victims, mostly elderly, and it was a tough 6 months, I got to tell you. And for a lot of reasons, I didn't finish. And I would have loved to have finished. But for financial reasons, I tore an ACL playing football. I had to kind of drop my bursary. And then, quite frankly, I had to go to work. Because, there's a lot of reasons why you don't make to the end of anything you do. But I ended up, going another path. But, I know the dedication that it takes to go. But you have a keen interest, always in the kinesiology. And I was reading sort of between how people function when they're dormant and how people function when they're moving. And you've done a lot of research in that field.
Totally, yeah. No, it's very interesting to hear that sport medicine piece because I was thinking along that same lines, right? And had the opportunity when I was doing my PhD to work with stroke as well, right?
Oh, wow.
Yeah.
So hard.
Yeah, stroke, MS patients and a lot of the challenges that they have around functional independence. And that's exactly what we did. So they have hemiparesis, mobility limitations. And most of my PhD work was focused on translating sport performance and being able to help people with stroke and MS recover functionally along that ways. There's one of the publications that I'm most proud of is actually an opinion paper that I wrote with my supervisor, Dr. Michelle Plowman, around sport, like periodization of training, right? Yeah. So models. So in rehab world, it's usually we have a period of time, about 3 months after stroke, people are heavily doing rehabilitation, then people get discharged, right? But trying to adopt more of a sport performance model where you have a longer term training plan to be able to increase functional recovery was one of the things that we worked on. Yeah.
Oh, that's terrific. And I know we have a group so one of our businesses in Toronto, I mentioned to you, we actually give heavily to charity.
Yep.
It's built basically on a charitable model. And one of the charities actually deals with MS people. And Sharon and I have actually been out to quite a few sessions where they have them boxing, they have them doing functions before they're, as they're progressing to try to keep their motor skills going and, as they're progressing through the disease, right? And that's such a hard thing to watch, but it's amazing to watch them because they're so resilient and the things they do, and really it's amazing. And it's interesting when I went to Northwestern Hospital.
Yeah.
So I went in, and you mentioned, the stroke victims, especially elderly people, tend to have like a huge paralysis in their limbs, right? Mm-hmm. And so they get very stiff. So you have to massage them, and you have to try to get motion to get blood flow and everything going. And we were doing that, and it's painful.
Yeah.
Right. There's a lot of pain to it. So we used to sing. And I always remember that as we used to sing all these songs to get their mind off it, which kind of, it's you go through life. My dad owned a moving company, and I used to work with him quite a bit, and furniture was quite heavy. And when I'm turning 60 now, so furniture was all mostly steel. And it was very heavy when I was doing it with my dad. Not today, like IKEA furniture. And,
much later today.
Yeah. So we used to go lift furniture, and we used to put the lifting straps under the furniture and the fridges and stuff. And they used to sing. So as we would lift, they would sing to lift the furniture because it was so heavy up and down the stairs. Yeah. So they didn't focus on the pain of all the lifting. Yeah. So it's interesting. I was doing that, and we'd sing along, and the people would sing, and it was quite the atmosphere it started off tough because they didn't want to get going with us. Mm-hmm. But over time, as we sang and we spent time with them during the day, they were happy. But it took time. It's like anything else. And, I was looking, it's interesting because I was kind of thinking about the show today, and I was thinking, medicine itself is kind of encapsulated in that, it takes so much time to develop something and to research it and get it to market. And, you have to be patient because the trials and the testing and failing and succeeding and going for approvals and regulatory. And I know, you're, as I was coming in today, you guys are getting a reputation of being really good at that. Mm-hmm. And I, in my hat off to you because, when the word starts to get out that the province is kind of starting to lead the way, tell me a little about that because, that's that's your leadership and your team. How are you guys managing that right now?
Yeah, so that burden of evidence, right? When you start thinking about coming up with a new medical intervention or layering things on behavioral like singing and stuff like that, when you're doing things like this, you need to demonstrate that it's first of all safe, and then at some point it's going to create meaningful outcomes for patients. From an innovation perspective, as you said, now. Within the hospital system now, we've set up our living lab, which is supposed to be a real world test bed for new ideas and concepts, right?
Oh, okay.
And basically, we say that no idea is a bad idea. Let's try and see what works. But you see, the thing with it, trying and seeing what happens is a lot of the challenges that you get to adopting. You need to have a structured approach in terms of how you introduce technology or process innovations into the system, and to be able to test them in a way that you're able to answer very specific questions. Is it safe? Will people use it if it's brought into the system? Can we feasibly measure outcomes and drive impact on that? And what is the effect of that solution if you're going to embed it into the hospital system? Mm-hmm. So that's largely what we've done. We've developed within our living lab model a specific approach to being able to bring innovations in.
Wow. I like the living lab. Mm-hmm. Yeah. And are you finding people coming? So it's interesting. I find, and again, that charitable business I'm referring to, I find it interesting. The more sort of innovative things I did in that business, because when I came back to Canada in 2011, I was living in the States for 12 years. I came back to Canada, started it up, and all of a sudden, everyone in the industry kind of came and they showed up at my front door eating and hanging out to try to figure out what I was doing. Are you finding people starting to, as you're developing the living life?